So what we're going to outline today a bit about what is endometriosis, about how endometriosis relates to the inflammatory triad. And we'll talk more about what that is. What's the role of inflammation in endometriosis and the genetic components to that? And then acupuncture evidence for endometriosis and other inflammatory and autoimmune conditions. What are some common clinical presentations that we're seeing in the literature and in clinics? And then diagnostic tools that I use in my own clinic, which stems from Japanese acupuncture. And I would just like to acknowledge my teachers, Kiko Matsumoto and Yoshi Shimamura, who are my teachers currently and who kindly come to Australia with Monica Kobleka, who comes to Australia to teach most years, but we missed them all this year. So the objectives today are just to provide some information about the presentation of endometriosis and what the current research says about describing the process of inflammation and how that relates to endometriosis, but also to depression and gut conditions, which we're calling the inflammatory triad. I want to outline the evidence for acupuncture for the endometriosis, depression, gut inflammation conditions, and describe it from a TCM perspective, and then what are our clinical presentations and diagnostic clues and observations. So then also when we looked at systematic review evidence for depression and acupuncture, this review by Mike Armour and Caroline Smith and colleagues at Western Sydney again, they looked at a meta-analysis examining the effectiveness of acupuncture in major depressive disorders. So Imqua Smith's studies looked at some healthy individuals and what happened in the brain activation. In these studies, they looked at any clinical trials that use manual, electro or laser acupuncture, and they found 29 studies that reported on 2,260 odd people, and that participants were eligible, and they included all of those into a meta-analysis to look at the outcomes. 22 of the studies were undertaken in China and 7 were undertaken outside of China. And the acupuncture showed clinically significant reductions in severity of depression compared to usual care. It also was superior to sham acupuncture, and it was also showed superior results when it was used as an adjunct to antidepressant medication. They also showed a significant correlation between the increase in the number of acupuncture treatments delivered and the reduction in the severity. So the conclusion from them was, acupuncture is a suitable adjunct to usual care and standard antidepressant medication.